Hi, everyone, and welcome to our second episode of Top of Mind, a program focusing on the neuroscience services provided by Baptist Health, Brain and Spine Care, which includes Miami Neuroscience Institute and Marcus Neuroscience Institute. Today, we are going to discuss epilepsy, as November is Epilepsy Awareness Month. An estimated 5 million people are diagnosed with epilepsy each year, according to the World Health Organization, and 50 million people deal with this disorder around the world. Joining me today is Dr. Pooja Patel, neurologist and director of the Epilepsy Monitoring Unit at Marcus Neuroscience Institute. Dr. Patel, thank you so much for joining us today.
Thank you for having me.
So let's start here. Tell us exactly what epilepsy is and just how people are affected by it.
So epilepsy is a neurological condition that causes recurrent seizures. Epilepsy is diagnosed after a patient has had 2 or more unprovoked seizures. And this diagnosis comes with its challenges, so it is a life-changing diagnosis for a lot of people because of some of the lifestyle modifications that comes with it.
Very good. And what are the different kinds of symptoms that are associated with someone who may have epilepsy?
So epilepsy causes seizure, and a seizure is a condition where, because of the abnormal asynchronous activity in the brain, a patient can have several manifestations, and that can include a staring spell or an episode of loss of awareness, loss of consciousness, or full body convulsions to make it its worst. Some of the comorbidities that's associated with epilepsy also includes memory impairment and mood disorders like depression and anxiety.
Are there risk factors for those who may potentially get it?
Yeah, some of the common risk factors include genetic causes in pediatric population, and in adult population, it is stroke, most common one, traumatic brain injury, brain tumor, brain infection. But then there are also a lot of triggers for causing the seizure, and that can include dehydration, lack of sleep, alcohol, drugs, and certain prescription medications.
And with all that, what are some of the issues somebody would have if they have epilepsy? Seizures, of course, I think is what a lot of people think of, but you kind of alluded there's other things as well that could be the case.
Right. So some of the challenges or issues that people have with having seizure disorder is the unpredictable nature of it, the sudden onset that can cause trauma. And it also comes with, unfortunately, a lot of restrictions, such as driving restrictions or work restrictions, such as being in a water body or being on a height or operating heavy machineries, if that includes your work. So those are some of the biggest challenges that comes with having this disorder.
What is it about this brain disorder that interests you when treating with patients who have epilepsy?
So epilepsy interests me because it is one of the neurological conditions that we are able to, with the help of diagnostic testing, precisely locate where the problem is. And because of that, treatment is very effective. So certain treatment modalities, actually there are a lot of treatment modalities that we can help patient with, and patient can have good quality of life despite having this diagnosis.
So that leads right into my next question perfectly. What are some of those treatment plans that now are set up for people that may have epilepsy?
So anti-epileptic medications are by far the mainstay of the treatment for epilepsy. About 60% of the population with epilepsy are successful in treating with anti-epileptic medications. But beyond anti-epileptic medications, there are newer treatment options, and some of that includes neurostimulation and also epilepsy surgery.
And when somebody has epilepsy surgery, is that more of a last resort that somebody would get that?
That is for refractory cases. So when anti-epileptic medications have not been successful, then is the time when we consider whether it's epilepsy surgery or the neurostimulation.
What about clinical trials or anything that's being done for people that may have this disorder? Is there a lot of research that's out there kind of focusing on this?
There's a lot of research that's out there, and it's still being focused on similar treatment modalities, so the anti-epileptic medications, but trying to find the ones that have different mechanism of action, so they might work differently on patient to provide better care and hopefully less side effects. Also from the surgical field, similar treatment options like still the surgery, but with different techniques, and that might help better outcomes and also fewer complications.
Is this a disorder that we're seeing an uptick in cases, or is it been kind of stagnant as far as numbers go over the course of the last 20, 30 years, in your opinion?
In my opinion, I think it has been stagnant. The number itself is a big number where a lot of population is affected by it, but it has been stagnant over a few years.
And what do you see ultimately as the future for people that have this disease, and how we treat this disorder maybe over the next 10 years or so?
So over the next years, I believe the future for the treatment, it's still with same treatment modalities, but fine-tuning it so that patient has fewer complications. One thing that I notice is the earlier recognition of this disorder. It's really helping patient prevent some of the morbidity and mortality. And hopefully in the next 10 years, this is going to be where we are recognizing earlier and earlier, and patients are not having the comorbidities that they are affected by with this disorder now.
Dr. Patel, thank you so much for this great information. It was, of course, very, very helpful, and we appreciate you joining us on today's program. And of course, if you would like more information on the Marcus Neuroscience Institute, be sure to go to the website. That's at Marcus Neuroscience Institute at Boca Raton Regional Hospital. That's BRRH.com. And we appreciate you joining us on today's episode. We look forward to thinking about you again on Top of Mind.